If you're ready to unlock more better days, to take control of your health, to push past your limits and unleash your full potential, then you're in the right place. I'm your host, Dr. Jeremy Bettle. For over 2 decades, I've worked with elite athletes and high performers, helping them optimize their bodies, strengthen their minds, and recover from setbacks. Now I'm bringing that expertise to you through the Vitality Collective podcast. In each episode, we'll dive deep into the science, strategies, and real-world solutions you can apply right away. Whether it's enhancing your physical performance, avoiding or recovering from injury, sharpening your mental edge, or simply feeling your best every single day. With insights from top experts and thought leaders, this podcast is designed to help you take action, feel better, and live the life that you deserve. Welcome to the Vitality Collective podcast, where every day is vital. Today I'm joined by Dr. David Putrino, a leading neuroscientist and physiotherapist specializing in cognitive performance and neurorehabilitation. In this episode, we break down the science behind brain health, from the impact of sleep deprivation to the surprising role of social connection in preventing cognitive decline. We also discuss how to track and enhance your mental performance. Whether you're an athlete, executive, or just someone looking to stay sharp. If you want to better understand your brain and learn practical strategies to optimize it, you won't want to miss this conversation. David, welcome. Thanks so much for your time today.
No worries at all. Thanks for having me. It's always great to chat.
Yeah, this is going to be a really exciting one. And it's an area I'm passionate about. This is something that my PhD research touched on, where we got into the decision-making processes around reactive agility. Tell us about your journey from starting out in Australia to where you are now.
Yeah, I trained in Western Australia, in Perth, which is a little town on the southwest of Australia. We've got really good beaches, and we're actually pretty good at training physiotherapists, and that was how I started my training. And from the outset, my practice was always a little bit different. I worked with neurological patients, traumatic brain injury, spinal cord, stroke, and I worked with high-performance athletes. And a lot of people couldn't really get their head around that, but I was just like, it feels like the same thing. It feels like we're trying to train an adult nervous system to do something better. And we can take tricks from either end of the spectrum and cross-pollinate. And so that was what I was doing. But in the meantime, I got a little frustrated that a lot of the practices that we were offering to our neurological patients just didn't seem to be the most evidence-based, didn't seem to be as good as they could be. So I went off and did a PhD in neuroscience, really basic science stuff. I was recording from single neurons and trying to understand how one neuron can fire, and that can lead to, a muscle twitching and so on and so forth. And I completed that work. It raised way more questions than it answered. And I had the opportunity to come out to the States to continue the journey, and I just got involved in computational neuroscience, where I was learning some of these more computational techniques like machine learning and developing algorithms that can analyze neural data in real time. And I went down quite a rabbit hole of basic science, neuroscience research, until the clinician in me was getting a bit itchy and I wanted to do things that were more applied. And I was starting to realize that there's a whole sort of area of science where you can do all of these experiments as long as you want, but you're not touching people, you're not changing people's lives. So shortly after that, I joined the team at Mount Sinai, and I had a very specific request at Mount Sinai, which was, we're going to be a disruptive innovation team, and we're going to work with neurotechnologies that really we think are going to move the needle of what's possible and get out there. And that was 8 years ago, and we've gone to work with all sorts of amazing sports performance partners. We got to work with Red Bull when Red Bull was doing all of that really cool stuff, dropping people out of spaceships and what have you. We work with elite military performers. We work with sports teams like the Brooklyn Nets and the US Olympic team and things like that. And at all times, we're really just trying to find good partners who are just as interested in us when it comes to learning about the body, learning about physiology, learning about longevity, performance enhancement, recovery, and just doing our best to move that along.
Yeah, so many fascinating points there. I really resonate with the transition from the elite to the general population. Doing a similar thing now in taking the techniques I learned in pro sport into this vitality, longevity space. there's just so many crossovers that go both ways. I always looked at it, it's just the human body. Everybody wants to feel great. And the biggest example we have of that is professional athletes.
Yeah.
Their job is to feel great every day and perform at their absolute best every day. And as a support staff, our job was to find every lever we could pull to up-level them, help them recover, help them perform in what is rarely a schedule that's designed for performance. When we talk about cognitive performance, I want to, for the audience, put some sort of parameters around that. What exactly are we talking about here?
Yeah, I mean, it's a great question because cognitive performance has so many aspects to it. When we think about cognitive performance, we start to think about how is your brain performing in different domains that range from things like executive function. So how well can you plan things out and stick to the plan and follow the plan in sequence to a favorable ending? How well can you regulate your emotions while that's going on? How well can you overcome challenges without becoming frustrated or dysregulated? You've got things that relate to, your storage capabilities. So what's your short-term memory looking like? What's your long-term memory looking like? Are you forming memories, encoding memories, and able to access them when you need them? We're thinking about processing speed. So how are you taking in information and being able to actually truly synthesize that information and act upon that information in a meaningful and productive way? And we'll talk about what productive and meaningful might look like, because I think that that's super important. And there are many, many, many other sort of aspects of cognitive performance that we think about. And then there are, you mentioned levers. There are all of these different levers that we can pull and investigate that can also affect cognitive performance. And that all builds into our process when we start to work with an athlete or just anyone off the street who is concerned about their cognition or isn't concerned about their cognition, but just wants to do a little better.
Yeah, this is an area I really want to dig into. Something I've seen over and over again with high achievers, and I would say, especially in coaching staffs, more so than athletes, is that they're really underplaying the role of sleep and cognition almost as a badge of honor, where first in the morning, doesn't matter if you landed at 3 a.m., they're in at 6, just really as a point of pride of depriving themselves of sleep in this sort of virtue signaling of working hard. Now that I'm out of sport, seeing it again with high achieving, whether it's executives or others within the industry, really having it as a point of pride that they sleep at the office and not, I think, fully understanding how well they can feel, how well they can perform cognitively, not necessarily noticing that they're not performing well.
Yeah.
So what are some of the things that people should be looking for, and how do you talk to the person who wears that badge of honor?
Yeah, I think sleep is probably one of the most important things that you can do to boost your cognitive performance if you're not getting good sleep. And I think that, as you say, that amongst high performers, there is this kind of the badge of honor is a good way of thinking about it. It's like, look at what I can do on so little sleep. And in general, I think there's just a lot of education that needs to happen. What we try to do, and in the short term, the education typically centers around some general education about the importance of sleep for brain health. So what do we know? We know that if you're not getting enough good quality sleep, it increases neuroinflammation, the amount of inflammation that is occurring in your brain. It causes mitochondrial dysfunction. Mitochondria are the parts of our cells, especially in neurons, that produce energy, ATP, and they can start to get very dysregulated and even damaged, producing reactive oxygen species and creating, again, even more inflammation in the brain if you're not sleeping enough. And we also know that over long periods of time, the studies have shown us that if you're not getting enough sleep, and enough sleep tends to be at least 7 hours. I think there's a study somewhere that puts it down to like 7 hours and 10 minutes, at least 7 hours and 10 minutes per night through to 9 hours. Like that's your sweet spot. There are studies that show if you're not getting that, over time, you start to see cortical thinning. So you start to see that compared to someone who is getting an appropriate amount of sleep, your neurons are dying at an accelerated rate. And when it comes to neurons in the brain, Although there can be some replenishment of these things, it's not as common as other cells in your body. So when they're gone, they're gone. And when we're talking about getting enough sleep, first of all, educating, then starting to talk about some myth busting, right? So there's a lot of people who are like, well, I go to sleep at 11, I wake up at 5. That's all the sleep I need. My body wakes me up. So I'm good. And actually explaining to folks that no, because it's cortisol, a stress hormone that wakes you up. So when we're getting sleepy, our cortisol levels are low. And then let's say 3 a.m, if you're a 5 a.m. waker, your cortisol levels start to creep up. And when they hit a critical level, that's when they sort of go, blah, brain, wake up, open your eyes, etc. It's cortisol that does that. And so if your resting levels of cortisol when you go to sleep are kind of a little bit high, that means that you're going to wake up. So if your stress hormones are running high, regardless of what you do, you're going to be one of those people that 6 hours is all you can get. But that doesn't mean that 6 hours is what you need. It means that 6 hours is all you can get because your cortisol levels are up here compared to everybody else, even when you're getting ready to go to sleep. So having these conversations around, first the importance, second, breaking some of the myths. And then the next step that we go through is just proof of the pudding, right? Showing people on whatever KPI that they choose that it gets better when they rest. We can do this over and over and over again. And it's similar to even just taking rest, like taking a weekend. People who work through the weekend thinking that they're being more productive when if you actually took the Saturday and the Sunday, you come back on Monday and you pound through the whole weekend's worth of work in an hour because you're so rejuvenated.
Right.
It's the same thing with sleep. The caveats, that we struggle with, folks, like in elite military or, elite surgeons that we work with, who, beyond their control, their call time is like 70 hours. And if there's a stroke, like if we go working with an endovascular surgeon and he's having a stroke every 2 hours or 3 hours while he's on call for 70 hours, which is a reality sometimes, they're not going to sleep for 70 hours, which means that what they need to do, unfortunately, is train hard skills to the point where those hard skills don't require a lot of cognitive processing so that they can do those hard skills asleep. And that is not healthy. And that is not what we would hope for people in these positions. And we need to always be advocating for how do we set things up, either in an elite military situation or in a hospital situation where those cases become more and more corner cases where someone needs to be up that long, because for everyone's safety and everyone's longevity, we want to avoid that. But we do also just need to acknowledge freely that in some cases, that's not the case. But unless you're going out there and, anyone listening, unless you're an elite military operator, active duty, or you're an endovascular surgeon on call, it's a pretty narrow field.
See, and this is where I think the confusion comes in, right? There's acute, there's chronic, so that there's your short-term impact, your long-term impact, but then there's all these edge cases where maybe there's 2% of people in the world who have a genetic marker that mean they can do well on a very short amount of sleep. There's people who are very much in the public eye. I think Elon Musk, right? He richest guy in the world and prides himself on no sleep. And they sort of get held up as examples of this is how you should do it. Everyone should be able to do this. I think bringing it back to, I'm not having to go on call and fly to Afghanistan in the middle of the night, right? Nobody's calling me to fix a stroke on a 70-hour shift. I think that's what we must do, is recognize that those are edge cases and it isn't healthy and they aren't setting themselves up for a very long life, but there is an uncontrollable element of their chosen profession that we must train them specifically for, much like we did with NBA players, NHL players. We're on a back-to-back. Yeah. It's going to be hard, right? But so how do we optimize for that specific scenario, knowing that that's not every night and that's not baseline that we want to prepare for?
Yeah. And also, I mean, it has to be said, two things, right? The first is when we're dealing with some of these corner cases, it has to be said that survivorship bias comes into play here. It's like, it's one of my pet peeves that someone sticks a microphone in front of a billionaire and says, "Why are you so successful?" And the billionaire says, "Well, I only get 4 hours of sleep a night," and fails to mention, "Dad gave me $40 million in my bank account when I moved to America." Like, it's probably the $40 million, not the 4 hours of sleep. When we hold heroes up, like, myth busting is really important. It's like, well, I read this book and it said that this guy only sleeps this much. And it's like, yeah, but that's probably not what made the person successful. Most books on billionaires are exercises in survivorship bias as opposed to actual good advice on how to become a billionaire if that's your goal. And then when you look at NBA players and NHL and people who have just this slammed schedule, it's like, that's not the way to get them to play their best basketball. If you ask them, like, what that would look like, most elite athletes that I've ever worked with are incredibly attuned to their bodies, and they will tell you, like, what the right cadence is for the best basketball, or the best hockey, or the best, whatever sport that we're watching. What we get instead is something different, because the audience is demanding quantity over quality. And so we've got into this sweet spot of, what the audience seems to be happy with in terms of regularity of games, but it's not the best basketball that they could be playing or the best sporting experience that they could be giving.
Yeah, that's exactly how I would think about the NBA. That I think the hardest transition to pro sport for me was coming to the realization that it was the entertainment industry, not necessarily high performance sport. And so the schedule is designed to maximize for money we can make from viewership, and not necessarily, like an Olympics where it's a peak performance moment. I used to dream about, like, how good would the hockey or the basketball be if we just played on Sundays, right? Yeah. If everyone played once a week, my God, those games would just be unbelievable.
And exciting, There's a lot more
so
going
exciting.
Into it. Yeah.
Right. I mean, look at the NFL, right? Those games mean something every night. I remember talking to a player before a game in the NBA, veteran player, been in the league almost 20 years. Like, "Oh man, you excited for the game tonight?" I haven't been excited for a game in 18 years. If I got up and down for every game, like, it wouldn't last a minute. So I really think that it is important to emphasize that we're not optimizing for performance. We're optimizing for endurance almost. Like, can we perform well enough, right, to still be really good and still execute good enough, but it's not the best that people can be. So what are some of the things you mentioned, the KPIs earlier, and that's the key performance indicators that we would talk about in sport and in business. What are some of the ways that we can actually measure this? Then this is a great way to demonstrate to somebody, here's how you perform sleep deprived, here's how you perform with some rest.
Yeah. So when we're working with athletes or just other clients, we always try to personalize what we're doing. A lot of our key performance indicators will be task related, so they will be depending on the sport that you're playing or the task that you need to excel at. We're going to work with you to find some outcomes that help you. The other thing that we do is we do also work on the side of some more traditional measures as well. So there are many neuropsychology batteries that allow us to test and interrogate different areas of cognitive function. So there's things like the Stroop test, where, it will do things like ask you to click on the red thing, and there will be a red thing, and there will be, something that says the word red, but in blue, right? And if you hit the blue, if you hit the thing that says red in blue, that's a fail on the test. But, these are sorts of things that, Stroop test, Flanker, Trails A, Trails B, these are all cognitive batteries that you can sort of look up that tell us a little bit about how you're functioning in little different cognitive domains of executive function and short-term memory and long-term memory and recall, etc. We will run a battery on everyone who comes through our system just to understand what's going on. And absolutely, you can see dips in executive function when people haven't slept. You can very, very clearly see they make more careless choices. They make make more mistakes, et cetera, et cetera. And, there's a whole bunch of literature out there that shows that when you're sleep deprived, meaning that like if you're operating on even less than 5 hours of sleep, you can be equivalent to someone who is over the legal limit of drinking alcohol. So you can be so tired as to be behaving similar to a drunk person in terms of
Right.
your reaction time and decision making and emotional stability. Another thing that we look into, it's a little more experimental, but it's very interesting to us, is we do quantitative EEGs. And EEG is basically measuring electrical activity that your brain produces. Quantitative EEG is, rather than just plopping some electrodes on the head and seeing what electrical activity is going on, quantitative EEG allows you to put in some sensory inputs. And in a healthy brain, you should expect certain responses from your brain from certain sensory inputs. And so that's exactly what we do. You put the headset on, you put some earphones in, and you sort of play some beeps, and you flash some things in the patient's eyes or the client's eyes. And based on 100 years of neurophysiology, we know that if you flash in this way, you're going to see something in the brain. And we measure how quickly that response comes, and we also measure how big that response is. And that gives us an indicator, because, again, we've known about these things for 100 years, so there's normative data sets where we can say, based on your age, your gender, and the things that you did last night, we can see what your brain is doing. And those batteries that I was just talking about, we often use them as baselines. So, like, unfortunately, cognitive health is not something that, when you go to the doctor, it would be awesome if, as well as taking your blood pressure and doing all your bloods, they would also throw in a couple of these batteries as well. Because I really do think, as we start to think about healthy aging and we start to think about longevity and how we want our cognition to perform over time, it would be really good if we could intervene early when we see some of these things flagging. But we don't currently do that. So if you come in off the street and you do this testing with me, the first time, I don't really know where you're at, but I can use that as your now baseline. And then we can try some stuff. And if the stuff is working, we will see, improvements on these tests.
Yeah, I really want to just emphasize this point. That measurement, we do those measurements with our clients when they come in. And people are always very worried about measuring the brain. And I saw this in sport as well, where concussion was one of those weird issues, or any sort of brain injury, that people wanted to leave alone. They sort of didn't want to mess with it. Just go sit in a dark room, because we don't want to mess it up. And I find it now, when we're measuring these things, people are like, am I okay? In that moment, do I have, this, that, or the other pathology? And I think that's such an important note to make, is that this is just a baseline that we are now going to track over time. And this will be very specific and unique to you. Your reaction time might not be what someone else is, but it's not a comparison between people. It's you versus you over time.
So important, and absolutely correct. We're collecting all of this data to show singular improvement over time, because not only is that the only thing that we can validly do, there simply isn't data out there to say that, across a whole population, again, because cognition and the brain is so diverse person to person, I can't promise you, hey, if we improve this one thing, you're going to be performing better than this person. What we can do is, we can work with you and we can improve your numbers. And hopefully over time, what you're going to notice as we improve those numbers is that some of these other things in your life are getting better and getting easier.
Yeah, and that then leads me into another segue here of individualization.
Yeah.
I think that's the other thing that we applied it in injury prevention. Each athlete's risk of injury was different. Both athletes might have come to a groin injury in very different ways, right? And so I think identifying a person's baseline abilities, but then also their unique mix of lifestyle factors or otherwise that might be feeding into that baseline, and those being that individual person's things to work on for that longitudinal improvement.
100%. There are so many different factors that we evaluate. I think even when it comes to personalization, you've even got to start a level higher, which is just like, what does the person in front of you want to achieve? In general, we tend to get, three sorts of things. The first is just like general brain health and longevity. I want to be doing things and adopting practices that mean that when I hit my 90s, if I hit my 90s, my brain is going to be sound. I'm going to have the best chance of not having Alzheimer's disease, having less age-related decline, and generally doing okay. So we've got folks who just want to have like long-term cognitive health plans in place. Cognitive enhancement is a goal. I want to do better than I'm doing right now. And interestingly, we won't talk too much about this because I don't think it's wildly appropriate or responsible, but
maybe we should talk about it
then. In certain circumstances, and we've mentioned some of these circumstances earlier in the chat, but in certain circumstances, there's short-term cognitive enhancement that people need or want, and there are drugs that do that. Mm-hmm. And they need to be decoupled from longevity and long-term performance because they're not good for you in the long term, but best believe they will peak your performance in the short term. And if that's what you need, there are protocols and there are things that can do that. Then there are other, slower burn protocols that can potentially enhance you over time. So enhancement is another goal of the sort of three main goals that we see. The final, one that we often see is remediation. So someone's experiencing cognitive loss or someone's experiencing changes in cognition, tried a million things and they can't seem to restore what they've lost. And there are many reasons that can happen from a disease-related standpoint, but you can actually get them back quite a bit of function by helping them with remediation strategies, helping them to live with the cognitive changes that they're experiencing and helping them to plan things out in a way that allows them to maximize the cognition that their new baseline level that they've had. And that can be an incredible relief for some people, especially, like some of the times that we see this in athletes is with, after a TBI, after a traumatic brain injury, you've got an athlete who was actually, quite high cognitive performance. And let's say they've lost 20 or 30% of their cognitive bandwidth. When you see them testing, they're still testing normal. This is a common problem, right? The tests are geared toward identifying serious cognitive dysfunction. Whereas if someone was functioning up here and now they're functioning here, they've lost something and they can tell that they've lost something. And in fact, if you're living that lifestyle of very fast paced and you've lost 20%, suddenly you're going to feel like your life isn't your own. You're going to feel as though you can't keep up. You're going to feel like you can't manage your own life. And that's where remediation strategies can come in, because we're not giving you cognition back, but we're teaching you how to adjust to the new reality until either we can get some interventions going that will help you recover from the TBI, or, you just sort of get your life back to an extent that you're okay with your new baseline.
Yeah, I really want to drill into this because this goes back to our athlete general population comparison. Many people listening to this will be executives, maybe traders, financial managers, these sorts of things, who they're cognitive athletes. Every day they've got to show up and operate at their peak cognitively over and over and over. Yeah. And so this is a really tough one for that individual to go through this experience with the baseline sort of being here. So every time they go to see the doctor or every time they go and get a checkup, they're fine. They're cleared. No problem. And so it can be a very invalidating and frustrating process to be spinning down here when you've lost an edge.
Yeah.
So that's a really important thing for me to emphasize, is that good enough isn't what we're going for here. Optimum is what we're going for. And we think about that across the board, from our musculoskeletal screens, from our blood work, all of these things. Just because you're in the range, that doesn't mean you're optimum. What are some of the things that people can pick up on here? Because we all know early intervention is the thing. We can catch this early. Often, much like with the chronic diseases, when we start reporting symptoms, when it finally gets to the point when we go to our doctor, I think we're sort of behind the eight ball there, and it's really hard to enter that remediation phase. There's going to be some blurring of the lines here between acute, I didn't sleep well last night, I feel a bit foggy, and when does that become something that somebody should be paying attention to? Or after an injury, I had a client whose daughter fell off her bike in San Francisco. She's founder of a startup and hit her head, right? And went through a pretty serious concussion. So how do people know sort of when they're ready, when they're experiencing these problems, and when to really start paying attention and acting?
Yeah, I mean, it's really tricky to sort of. I mean, I would say that from a cognitive health standpoint, if you're noticing something dropping off, you've got to be on it from the outset. I would say that when it's happening out of the blue, so like you can't tie it to a specific cause, then I would say that it's something that should be addressed quickly, right? Like if you suddenly notice that you're cognitively dropping off a cliff, where you were able to do all of this stuff a day or two ago, and now you're struggling and it doesn't seem to be going away with a good night's rest or what have you, or taking a couple of days to chill out, you got to be getting to a doctor right away and saying, hey, something has suddenly changed and I don't like it. When it's linked to something more proximate, when you can actually say, yep, I fell off a bike and I'm not doing great. Or, one of the more common causes of cognitive decline right now is COVID. So you've had an acute COVID infection and cognition has started to suffer. I think you can allow yourself a little bit more recovery time. So a concussion, many people aren't feeling themselves until 2 or 3 months after the concussion. And that's a normal thing related to recovery from a mild TBI. And what you want to be doing is giving yourself lots of brain breaks, a sort of a graded return to your normal daily function, and really being patient with yourself, really signaling to, coworkers, what have you, that I sustained a brain injury and, I'm on a rehab plan and, I'm moving toward getting better. And from that standpoint, not to say ignore it until you hit 3 months and then panic. It's to say, keep an eye on it. You want to be making sure that you're improving, not plateauing from where you were before the incident, whether it be an infection or a blow to the head or whatever was the cause. You want to make sure that you're slowly improving, but also understanding that long tail recovery on these things typically can stretch out for 2 or 3 months, and be patient with yourself, be kind to yourself, and do the work. But understand that it could take that long. And then if it's not, fully resolved by 3 months, that's when you start to sort of say to the doctor, okay, I've been a good soldier for 3 months. I'm still not where I was. I feel like I'm plateauing. Let's go deeper. Let's start doing some imaging. Let's start doing more detailed interventional assessments, which we can dig into in more detail.
Who should I be seeing? We talked about the gap between here's the baseline, here's what we're going to measure as your function, here's where the elite performer sits. I don't want people to spin down here for 3 months, right? Yeah. In a go sit in a dark room sort of protocol.
Yeah.
Who should they go to see right away, day one, to make sure that the work that they're doing and the interventions that they're in are the appropriate ones that will improve them, versus that very, very conservative approach of sit, rest, let it heal. And then second, I'd like to go into what is the work, right? Yeah. What are some of the ways that we can get back here?
So, I mean, I'm a huge bias. I'm from a rehab department, so I'm going to say physiatry is the first port of call. But the reality is, unfortunately, what we don't have is any one group of professionals who are owning the work for brain health, and that's a real shame. you got to find someone who works well with you. And hopefully, what we can talk through like a systematic approach to monitoring brain health. But really what you want is a professional who understands what's going on, has a systematic approach, has a plan. Like, that's the most important thing here. And has a plan that, makes sense to you in terms of like, here are the things that we're going to measure, and this is why we're measuring them, and this is how we're going to know if it's working. These are the questions that a patient should be asking the provider, is like, what are you testing? What does it tell you? And how do we know when the intervention is working? What will move when the intervention starts working? And if your provider gets annoyed at any of those questions, that's not the right provider for you, because yeah. But, from that standpoint, I have worked with truly exceptional neurologists, physiatrists, neuropsychologists, and even neurosurgeons who have a really good working understanding of what brain health should be and help to guide their patients through procedures and protocols that can improve brain health.
And so I'd like to understand some of the mechanisms of what we're actually trying to heal here, and when we, both acutely in the case of traumatic brain injury, but then also some of the other stuff that we had discussed on a previous call we had, as we start getting into those sort of disease states, and it not necessarily being the things that we thought it might be, a lot of stuff about amyloid plaques and all this sort of stuff. What are some of the drivers of the dysfunction, both acutely with traumatic brain injury, but then also as we progress into a disease state in the brain?
Yeah. I think some of the things that we start at are some of the obvious things. I would say that there's probably 4 or 5 really, really obvious things that everyone should be doing to understand where your brain health is at and what it might look like on a spectrum over time. So those things are sleep. We've given a lot of time and energy to sleep now, but suffice to say, sleep is important. Nutrition and hydration, super important, especially for cognition. So checking in on what people are doing. People do wild things with their nutrition and hydration. People tell me the craziest stories, and then they can't possibly think why at 11 o'clock in the morning they're crashing, and it's like, because you haven't eaten anything or drunk anything for 13 hours, like that's a problem. So there's a lot of like pretty basic stuff when you actually get people to map it out, and then you layer on some general education. So yeah, sleep, nutrition, hydration. We screen everybody now for social health. Like, what are the relationships in your life? Who are you hanging out with? What is your social circle like? How often are you having not work-related, but like meaningful social connection with other human beings? Because loneliness is one of the biggest drivers of immune dysregulation, impaired vascular health. And we haven't been touching it for the longest time. And yet it's one of the biggest predictors of Alzheimer's and other dementias. As well as having a lot of physical health sequelae that are relevant as well. So we screen for people's social health. Similarly, we screen for auditory health. A lot of people who we now know that loss of hearing is one of the biggest predictors of cognitive decline. So tracking people's hearing is super important. And so these are things that we'll just like routinely look into because they're quick fixes and they can lead to a significant uptick in improved outcomes. Then we sort of start to move into still more routine, but deeper health assessments. So we want to know about your psychology, obviously. So people who are having untreated anxiety or depression will experience cognitive decline because the depression and anxiety are incredibly resource taxing on a brain. And so when you're using all of your brain energy being depressed or experiencing anxiety or experiencing, other mental health conditions such as bipolar, so a manic state or, a depressed state, these are things that take up a lot of energy. And then you don't have cognitive energy for other things. And so checking in on mental health can be crucial to helping with boosting cognitive performance. Similarly, we're interested in hormonal health. We see so many people who low energy, have a foggy sort of like, whatever's going on, their testosterone is just in their boots. Consulting on hormonal health can really change someone's energy levels and cognitive energy levels, which can really, really make a big difference. Then we start moving into things that are a little bit less mainstream, but very, very important. Autonomic health is one of those things. So we look at the autonomic nervous system, which is the part of your nervous system that kind of tells you how fast your heart should be beating, tells you what, it does all of this. Like, sometimes I'm amazed that we can sit upright and do things because, the autonomic nervous system is the part of your nervous system that finely tunes your blood pressure when you go from sitting to standing so that you don't pass out. Your brain continues to get blood. It's wild that our bodies know how to do that without any coaching or anything. They just figure it out. That can get knocked out of balance. And then suddenly you're not getting blood to your brain. And it's not enough to knock you out, but it is enough to make you, not able to cognitively function on any serious level. There's, so many interventions that we can give to patients that are both drug and non-drug that can improve autonomic health. And suddenly their cognition turns a corner and they're just like, oh my God, I can't believe I was walking around like a zombie, and now, this is the new normal. We also look at immune health. As we've started researching COVID and long COVID, we've gained a greater appreciation for how important people's history is of, infection-associated disease. Right. And we're starting to learn more and more about the fact that viruses have such an important role to play in our cognition. We have a lot of viruses and other pathogens living in our bodies that are latent, but they infect nervous tissue, and they can affect brain function. And there was a recent study that just came out in Nature that showed if all you do as an adult over 60 is take a shingles vaccine every 3 years, I believe is just take your shingles vaccine when it's supposed to happen, your chance of Alzheimer's and other dementias is decreased by 17%. That's all you need to do is keep that herpes virus that is potentially in your brain under control, and your chance of dementia is significantly reduced. So point being that we're learning that a lot of this stuff that we just sort of said, well, this is age-related or this is, related to Alzheimer's disease that we don't fully understand, except for these amyloid plaques show up and who knows why they're there, could be related to infectious reasons or immune health reasons. And so that's where things like vaccines for these viruses, antiviral therapies, if people are sort of testing consistently for having reactivation of Epstein-Barr, or even new drugs that are of real interest to the field, like low-dose rapamycin, which has been shown in multiple studies now to improve natural killer cell function, boost T-cell activity, regulate interferon signaling, and reduce systemic inflammation, could be a really interesting drug to start looking at in terms of maintaining cognitive health. And then finally, one of these more sort of overarching things that we look at is metabolic health, which we start to think about mitochondrial dysfunction. We start to think about, how is the body just functioning in general? Is it producing more energy than it needs just to sit at rest and idle? Or is it acting in a more efficient way? And the reason that metabolic health is so important is by far the organ that uses the most energy that we produce is our brain, by far. There's no organ that comes close to the energy expenditure that our brain requires. And so if you start to experience mitochondrial dysfunction and metabolic dysfunction, the brain is going to be the first thing that starts to misfire because it's the biggest energy hog.
Interesting. And that plays into, again, something we mentioned in another conversation we've had around that energy production being one of these drivers, right, for the loss of cognitive function and then maybe a driver of the disease states.
Yeah, exactly. For the longest time, Alzheimer's research has kind of been stalling on this idea of these proteins, these abnormal proteins that show up in the brain when you have Alzheimer's disease. So, back in the day when people started to name Alzheimer's disease and started to study it, one of the most striking features that was first identified was, well, people seem to have these plaques, they called them, in the brain. And when they dug into it, it was proteins, these amyloid proteins that were showing up. And for like 20 years, billions of dollars were poured into, well, what happens if we can just create a drug that removes these proteins from the brain? And lots of federal research money went into that. Lots of pharma research money went into that. And over again, what it seemed to show was that getting rid of the plaques didn't really fix the problem. And over the years, there's been a few really clued in researchers. I was really fortunate to work with one of them. His name's Gary Gibson, and he's a guy who's been studying Alzheimer's for all of his career. The whole time, he's been saying to me, he's like, the plaques, they're just tombstones. Don't worry about the plaques. Like, the problem is that you've got a brain in energy crisis. Mm-hmm. So you need to figure out why the brain is not producing energy the way that it's supposed to. And, one of his innovations, and to my knowledge, he has one of the only clinical trials in the history of Alzheimer's to show any success in reducing cognitive decline. And that was by using a supplement rather than some fancy drug that Pfizer's trying to make or whatever. He found a supplement called Benfotiamine, which basically does a really good job of making B vitamins more bioavailable to the brain. So it makes it easier for the brain to harness B vitamins to improve energy performance. Even in folks in his clinical trial, he worked with folks with Alzheimer's who were quite severe. Even in folks who had quite severe Alzheimer's, he was able to show benefit between the treatment group and the placebo group in terms of slightly improved cognition, but more importantly, when it's Alzheimer's, slowing decline. And so understanding, not saying everyone run out and buy benfotiamine, but understanding that, like, what we need to think about when we're considering these things is, why is the brain in energy crisis? Is it because it can't get enough B vitamins? Is it because there's a vascular problem, and so we need to unclog some of these arteries, which is another supplement called Nattokinase is one that is frequently used in that regard. Is it because there are viruses in the brain that are hogging energy production? A little known fact about viruses is they don't have their own mitochondria. So when they infect our cells, they hijack our mitochondria, which is very rude. And and they use our mitochondria to produce energy. And so then our mitochondria can't produce energy for two. So, all of a sudden you're running on, half on empty before you've even started. And so understanding all of these things that can cause energy crisis in the brain could be crucial for preserving or improving cognitive health.
Wow. Okay. So there's a lot to unpack there that is so critical. I love the view of the tombstones. What immediately came to mind was we look at a graveyard, and if we go and pull out all the tombstones, it doesn't mean there's no dead bodies in there.
Exactly.
I think that's a fascinating concept. And really, just like injury prevention, the injury is the end result of a series of different factors that led somebody to be susceptible to maybe tearing that muscle. And I think maybe the same here with the energy crisis in the brain. So we've got to get differential diagnosis here. People have to know specifically for them, why is their brain struggling for energy?
Or, to be clear, if we're just purely through the lens of performance, if they're happy with their brain function, but they want to improve performance, what are the most promising levers that we can pull to move that forward, rather than the scattergun approach? Because, I listed like 12 or 13 systems of testing there. And if you, as you well know, Jeremy, if you give people like that many things to do, that's going to last about 5 seconds, and then they're going to go, nope, too hard, too exhausting, I'm not doing it.
The question that immediately came to my mind, and I'm sure everyone who's here listening, okay, how do I know whether it's vascular? How do I know whether it's a virus? How do I know whether it's one of these other factors? So I get the right intervention. And then secondly, I don't have Alzheimer's yet. Can I start taking these supplements, or can I start one of these interventions now to ultimately prevent that disease progression from happening?
Yeah, absolutely. And I mean, and that's where we really go into detailed testing. And what we do in our center is kind of tiered testing. So we try and do the most lightweight testing up top, which evens just starts with questionnaires that can give us clues about what symptom constellations seem most likely to be tying on to certain causes. And so we will start off, like when someone comes into our clinic, start off with just patient reported outcomes that, tell us about this and tell us about that and how much are you sleeping? And again, let's pick on sleep. Now, if they say, I don't sleep the night through and wake up every 2 or 3 hours, well, obviously we're sending you off for a sleep study. And we're going to see, do you have obstructive sleep apnea? Do you have narcolepsy? Are there things that we could be doing? When we're looking at nutrition and hydration, we're asking them to keep a food diary. We're trying to understand, are you doing intermittent fasting? Did you listen to a podcast to get your intermittent fasting advice, or did you talk to a registered dietitian? And are you taking into account your hormonal health when you're fasting? Because again, something that I don't think a lot of people know is that even the way that men and women time their fasting, if they want to time their fasting, should be different because of the prominence of different hormones at different times in a daily cycle for men versus women. Just listening to one podcast and being like, I'm going to look at some sunlight and then dip in a cold plunge and then fast for 8 hours, that ain't going to work for like every single person. Most of that research was done on white dudes at a college level. One of the craziest facts that I've ever been exposed to is even when you read the animal research, because sometimes people like reading the animal research being like, well, there's no chance of a placebo effect here, it's an animal. It's male rats. And when you speak to researchers, why don't you use female rats? Well, their hormonal cycles make their responses very unpredictable. And I'm like, yeah, really unpredictable. You probably want to know that, right? You probably want to know how that works. Otherwise, your interventions aren't going to work on 50% of the population. So what are we doing? But this is what gets trickled up into practice. And again, this is the need for the personalized approach. So yes, for psychology and social health, we're having people talk to professionals to screen for these sorts of things. For immune health and hormonal health, we're doing blood testing to look at all the hormones and T-cell signaling. And I think one of the most important things I'll say about hormonal health is understanding that hormones aren't static. So you want to be doing testing throughout the day, not just like, I tested my cortisol and it's fine. It's like, no, cortisol cycles every single day. So we want to know what your cycling curve looks like to understand, what's going on here. And similar with testosterone and similar with progesterone and estrogen. We'll look at resting metabolic rate. So how much energy are you burning when you're not doing much, just sort of sitting in a quiet room? And autonomic health, people with autonomic nervous system dysfunction will see blood pressure and heart rate change progressively over time. And then vascular health, we look at a bunch of blood biomarkers. We also use a device called the EndoPat, which is FDA approved for understanding endothelial function and health, how healthy the insides of your blood vessels are. So lots of ways that we can test. And again, we don't do all of that all at once. That can be a waste of time. It can be a waste of money. What we want to generally do is start off with just a few questions that then lead into, well, sounds mostly like these are the things that we want to check in on with you, and then we can then we can start to get a little bit more actionable with our assessments and then add in some interventions.
Right. What today, if I don't have access to a ton of stuff, what are 3 things that I could do today, this week, to really optimize my brain health?
Yeah, I mean, I would say 3 things would be sleep, nutrition, hydration. I'm gonna lump them together and cheat, but sleep, nutrition, hydration, and social health. One good thing that we have from the literature is over decades of failed drug studies to improve cognition, we've learned that good sleep, nutrition, hydration, and having rich and fulfilling social connection are 3 of the most important things, 3 of the most important disease-related modifiers for cognitive health. So these are the things that you can do that will sometimes outperform drugs in clinical trials. It's like the people who had those things on lock were doing better than the people, who were getting the drug.
Wow, that's just incredible. I mean, this whole conversation has just blown me away. We'll have to make series of ongoing conversations. Mate, where can people find out more about your work? Where can people follow you to learn from you, potentially work with you if they're concerned about something or just want to optimize?
Yeah, absolutely. I mean, my work and the centers that I work with at Mount Sinai are on the Mount Sinai website. So, it's pretty easy to search me and hunt me down through the website in terms of getting an appointment at the clinic or anything like that. And online, I'm at Putrino Lab in most of the sort of like social media, Twitter and Blue Sky and Instagram and those sorts of things. And I'm pretty active on those platforms, just sort of talking about some of the research that we're doing and things that we find interesting.
Beautiful. Okay. Well, David, again, thank you so much. I just can't believe how much we were able to pack into an hour there. We'll link the studies you were talking about, the researchers you were talking about in the show notes so people can find those, and we'll add all of the links so people can hunt you down and have their own interesting conversations with you.
Sounds great. Well, thanks for having me. This was a lot of fun.
All right. That was an incredible conversation with Dr. David Putrino on cognitive performance and brain health. Here are the 3 key takeaways from today's episode. Number 1, prioritize sleep. Getting 7 to 9 hours of quality sleep each night is essential for cognitive function, emotional regulation, and long-term brain health. Number 2, nutrition and hydration matter. Proper fueling and hydration support brain energy production, reduce inflammation, and optimize performance. Number 3, foster social connection. Meaningful relationships and regular social engagements are crucial for mental and cognitive well-being. If you enjoyed today's discussion and you're looking for ways to optimize your brain health, Vitality Collective is here to help. Visit www.vitality-collective.com to learn more about how we incorporate these principles into personalized health strategies. Thanks for listening, and we'll see you next time.